The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name's Marc Ryan. It's a pleasure to be hosting the podcast, and thanks to everyone for listening in. Today's topic is going to be about hospitals. Some people think of hospitals as sort of my arch nemesis because I am a very pro-health plan person. But I did also want to tell you that I have a good perspective on what hospitals go through as well. I am a former board member of two hospitals, one a children's medical center and one an academic health center. So I'm very, very familiar with all that hospitals out there offer the community. They take the lion's share of the burden in many ways of graduate medical education. And while they are reimbursed, I know a lot about what goes into setting up a hospital infrastructure to further graduate medical education for doctors. On the children's side, I sort of have a unique perspective about what a children's hospital goes through, and the fact that they have to be a community asset, but also maintain specialties and subspecialties in areas for children, children that suffer from major catastrophic illnesses or rare diseases. And these specialties don't always pay for themselves. So I do have a fairly unique understanding of hospitals, having been a board member of two of them. But I am also somebody very experienced in health plans. I've been with many different health plans. I have actually negotiated hospital contracts from a health plan perspective. I have seen the effects of hospital monopolies in one county and how that created problems for health plans to put together networks and have affordable rates to keep our premiums low. And I've also seen counties where there was vigorous competition. Notwithstanding whether a county had monopolies or had vigorous competition, I always heard from hospitals that they were asking me for outrageous commercial or employer rates because they were losing money on Medicare and Medicaid. And that was sort of the drumbeat of hospitals and the hospital lobby for years and years, decades, and it still is so today. But I will say that I have also seen hospitals clamoring for funding at the state level, especially in my state of Florida, and the great deals they got for Medicaid add-ons and uninsured care. So I always doubted whether this idea that hospitals were being under-reimbursed by government programs were correct. And if they weren't, why were they demanding such high commercial rates along the way as well? So it's in that spirit that we are doing this podcast today to really uncompact, is it true that hospitals are under-reimbursed for Medicare and Medicaid? Just because commercial rates are higher does not mean that they are under-reimbursed for Medicare and Medicaid, because as I've alluded to, hospitals have sort of manufactured the crisis. They claim they're under-reimbursed in government programs, and therefore, over decades, they've built commercial rates that far exceed government program rates. So the real question to ask is, could hospitals survive and even make a profit on Medicare and Medicaid rates? And if so, could commercial rates come down? And I think that's the real question. Again, not buying into what the hospital lobby has said for decades. Today, we're also going to talk a little bit about the fact that the hospital lobby is perhaps the most powerful healthcare lobby in America today, both at the federal level and at the state level. They have ensured that they have friends on both sides of the aisle through various means. There are lawmakers and others with jobs at hospitals. There are family members with jobs at hospitals. There are lawmakers and family members that may be on a hospital board and things like that. So they've gone out of their way to make sure that lawmakers on both sides of the aisle are very sympathetic to their cause. And that has allowed them to gain major, major changes regarding health plans, especially. They've fought for in one state and federal restrictions on prior authorizations. They've brought great attention to claim denials and things like that. And so they are an extremely powerful lobby, the hospital lobby is. In being the most powerful healthcare lobby in America, they've also resisted reform. They stand vehemently against reform of their own hospitals, and especially reform of pricing, such as site-neutral payments. But I think the pressure is building on hospitals to reform. More and more people are seeing that when you dominate so much of the total healthcare pie, reform has to occur because it not only hurts the system as a whole, but it hurts employer groups being able to continue to afford to provide coverage to their workers. And it also has huge impact on out-of-pocket costs. Now, the reason we're also doing this podcast is because there was a blockbuster survey that just came out that will further keep the pressure building on hospitals to reform. Third Way, which is a center-left think tank, blows a hole in the hospital's biggest argument that they cannot survive on government program payments, Medicare and Medicaid, and thus they need to jack up commercial payments obscenely. Again, businesses are already at a disadvantage in the world because they shoulder a burden that other nations' business don't have, the cost of providing healthcare. We have a predominantly employer-based healthcare system. But by jacking up costs in the commercial and employer world, hospitals are actually making American business that much more disadvantaged out there in terms of competitiveness. What Third Way found is that a well-run hospital can make money on government program payments, and that commercial rates could come down dramatically, and hospitals holistically between Medicare, Medicaid, and commercial could make a good margin. And we would save billions and billions, if not tens of billions of dollars each year. We would still have strong hospitals, but at much lower costs, and we might actually see quality at hospitals increase. But hospitals clearly don't want that. They like inefficiency and the traditional story they tell. So when we get back from our first break, we'll start digging into this very important issue, and we'll get into the hospital's playbook a little more politically and what Third Way found.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth Podcast. We're talking about hospitals and a brand new blockbuster study that sort of blows the hospital lobby's argument out of the water. As we said before the break, hospitals argue they can't possibly make money from Medicare and Medicaid rates because rates are too low, and therefore they have to charge obscenely high commercial rates to make up for it. What I find so disquieting about the hospital lobby is that they look a lot like the brand drug lobby. They cry that they will be put out of business if funding and laws change, but they never want to show their facts to back it up, or they invent the facts. They also stoop to rhetorical attacks where they question the motives of a study author, for example, rather than the underlying premise or findings in the study. So it was the case with the Third Way's recent study as well. I'd like to read a quote from essentially the hospital lobby answering the third way study. In a blog, the American Hospital Association said, quote, "We strongly discourage anyone from taking seriously the Arnold Ventures misinformation campaign and the flawed conclusions in the third way report," end quote. And Arnold Ventures, just so everybody knows, is an entity that backs healthcare research and things like that. And again, Third Way is the center-left think tank. And so that was sort of how the hospital lobby, the American Hospital Association, responded to and sort of dismissed a very credible analysis on the truth about hospital costs and finances. And that's a bit like the playbook that hospitals have built over time to win in the political environment. And let's just sort of talk through some of that playbook. Well, number one, hospitals declare that they are efficient healthcare providers, but you cannot ask them how this is so. You must take what they say and their financial analyses at face value. So they don't want anybody peeping into their books and things like that. Just take what they say for face value. Number two, they argue they're the most compassionate of providers out there. They give so much to the community, but please also do not look at their record of suing patients for obscene amounts based on their exorbitant charge masters. So again, they want to have it both ways. Third, they also argue that hospitals are pillars in their community and often can be the biggest employer in a given town or city. So they play the labor card in essence. They in essence are saying, mess with us and it could cost a huge number of jobs, which certainly scares lawmakers and policymakers and others when they're talking about reform. Fourth, they again argue, as we've been saying, that government programs radically under-reimburse, causing financial pressures almost every year for hospitals. Again, please take what they say at face value and don't ask them to prove this because they don't want anybody really looking into their numbers. Fifth, because of this, hospitals must transfer costs to the commercial world and demand much higher reimbursements. They argue they really have no choice. Sixth, spending more always means better quality in the hospital world, right? And cuts, of course, will mean poorer quality. Again, that panics lawmakers and policymakers. Again, you got to take what the hospitals say at face value. They don't want others evaluating whether they really are quality providers and what would happen if somehow rates were dropped. And lastly, by the way, insurers are the real culprits out there in the healthcare systems. Hospitals do not want to be constrained by managed care. They alone, they argue, know what is good for patients and the healthcare system themselves. So that's essentially their playbook. And it's been around for, again, decades in various forms. But that really is the same playbook that they've worked and worked and worked. And to their credit, they've worked it with much success over time. But in came the center-left think tank Third Way's report, which, as I've argued, fundamentally challenges many of these assumptions and consequently triggered the AHA's visceral response that I read to you a few moments ago. Apparently, again, anyone questioning the hospital's playbook does not deserve a thoughtful response at all. So when we get back from our second break, we will go into the study details very deep.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back. And again, we hope you're enjoying the Healthcare Labyrinth podcast. We are talking about hospitals here and a brand new study that sort of blows a hole in their arguments that they cannot make money unless they overprice their rates in the commercial world. So we're talking about that third way study that blows the hole in their arguments. And I would just note that this is not the only study out there. There are a number of previous analyses that show that truly efficient hospitals can earn margins in government programs. Because commercial rates are higher, it stands to reason that the entire enterprise can be healthy as well if they can make money on government programs. I read about the hospital inefficiency phenomenon in Marty McCary's books, Uncontrollable and the Price We Pay. As well, I've told you about my personal experience as a board member to hospitals. I recognized again that hospitals make unique contributions, but at the same time, financials always appeared much more focused on the revenue than the cost side. We were constantly focused on, as board members and as executives, on when we could get the next dollar from the government and not about tightening our own belts or economizing. So what did the third way study conclude? Well, third way's findings, again, crush hospitals' fundamental argument that government programs under-reimburse. The third way analysis, which in part relies on work by the Loan Institute and the National Academy for State Health Policy, both very good groups as well. So the third way analysis argues that a significant number of hospitals, particularly those that manage their costs effectively, are profitable even under Medicare and Medicaid reimbursement. This conclusion was derived from hospitals' own Medicare cost reports and Medicaid cost reports. So it is hard for the AHA to refute with anything but personal attacks and innuendo, as we've seen. Third Way concluded that 55% of U.S. hospitals make money on Medicare payments, with 33% making money on Medicaid payments as well. That's amazing. The efficient hospitals made money in Medicare by keeping costs down, saving almost $4,000 per patient discharge, $12,000 for those making money versus $16,000 for those that did not. Of those that made money, most of them made 10% or less on Medicare. In contrast, most hospitals that lost money on Medicare had significant losses over 10%. So in essence, the more you spend in the hospital world, the worse you do financially. MedPAC, the congressional policy arm, has weighed in on the subject too, and they stated, quote, when providers, particularly nonprofit providers, receive high payment rates from insurers, they face less pressure to keep their costs low. And so, all things being equal, their Medicare margins are low because their costs are high. End quote. That was well said by MedPAC. You can see my August 26 blog on my healthcare site, healthcarelabyrinth.com, for great graphics on the third way study. And now let's go a little deeper here. With the fact that hospitals can make money under Medicare and Medicaid rates, third way also gives us a glimpse of where commercial profitability might be for hospitals. They give the example of Duke Regional Hospital in Durham, North Carolina. The hospital makes money on both Medicare and Medicaid rates. Third Way says the break-even point for commercial operations at the hospital might be somewhere about 154% of Medicare. It charges about 258% of Medicare and makes a 35% profit on commercial insurance. That commercial charge is about the nationwide average of 254%. If you extrapolate this across the nation, the difference between the 254 or 258% charge that a hospital makes for commercial products versus the 154% break-even point at Duke could be worth hundreds of billions of dollars annually to the system. Now, of course, hospitals deserve a margin too. But let's remember that health plans make 5% to 10% in a good year. So a 35% commercial margin at Duke Regional Hospital is clearly very high. If you go to my website and look at the charts that I talked about from Third Way, you will very clearly see that there is plenty of room to lower commercial rates at hospitals, make a margin at the hospital, and still save the system tens of billions, if not hundreds of billions of dollars a year. So Third Way really has done a great public service here by telling us about the commercial break-even point as well. Third Way also found that 9% of hospitals pad their bottom line by collecting more money for charity care than they pay out. In my experience, part of that ties to lucrative Medicaid and Medicare funding for high Medicaid and Medicare caseloads, as well as uninsured populations. I told you earlier that that's sort of what happened in Florida Medicaid as well. A recent study published in Health Affairs found the cash reserves of nonprofit hospitals grew 68% from 2012 to 2019, while charity care spending dropped. Third Way concludes that hospitals that make money from Medicare patients actually provide more in charity care than hospitals that lose money. Finally, the report has a great case study. It compares, again, Duke Regional Hospital in Durham, North Carolina, with Mercy Hospital Southeast in Cape Girardeau, Missouri. Duke is efficient, profitable in Medicare, and delivers quality care. On the other hand, Mercy loses money on Medicare, has higher prices, and has worse care. The Loan Institute studies cited in the Third Way analysis also point to the fact that lower costs, not higher ones, help improve quality at hospitals. In the end, it's really a tale of two hospitals, one well-run and efficient, and another still using the hospital lobby playbook. With that, we'll take our last break and we'll come back to conclude the podcast.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back. What is really sad is that despite the clear evidence in the Third Way study, hospitals continue to buck efficiency in favor of political power and political activities. I continue to argue that most hospitals simply don't want to be efficient. Hospital executives rule over vast empires, and efficiency would mean a smaller footprint and less influence. Hospital bureaucracies remind me of government, where change is slow, fiefdoms cripple innovation, and accountability is missing. More importantly, being efficient is a lot harder than the status quo of demanding more and more government money and higher rates from employer coverage. Hospitals do this by misrepresenting their costs, margins, and financial health, as well as setting very high charge masters from which to negotiate. This justifies the huge cost transfer to employer coverage. As Third Way notes, numerous studies show that employer coverage pays on average 2.5 times Medicare. As the report argues, quote, hospitals persistently spread the myth that they are losing money on Medicare to justify large markups to patients with private coverage, end quote. While a small number of hospitals have taken to true reform and transformation, most have not. Instead, they have extended their efforts to bolster their political position to ensure their hospital gravy train and fight reforms. Consider the following list here, some of which is cited by Third Way, but some of which comes from my experience. First, hospitals love the unaccountable traditional Medicare fee-for-service system, which asks few questions of hospitals or providers when it comes to service provision or payment. As such, the fee-for-service system has had unsustainable inflationary increases and has waste, fraud, and abuse. Second, fearing the accountability provided by the Medicare Advantage world when it comes to utilization in the right place of service, the hospitals fought for MA prior authorization restrictions. MA plans now must follow physician certifications when it comes to whether someone needs an inpatient stay or certain post-hospital acute care. With the majority of physicians now owned by hospitals and health systems, that certification becomes easy and will drive hospital revenue. Hospitals also attack MA's scrutiny of claims payment. Because of its political power, it has won friends on both sides of the aisle who will back the attacks on MA and water down MA's cost savings potential. Third, hospitals favor massive consolidation in their industry to raise prices. Quality tends to also go down, not up, when this happens. Next, hospitals also buy physician practices to change practice patterns to more expensive inpatient and outpatient hospital services. There has been a notable shift toward higher-priced hospital-owned places of service, costing the system more and more money each year. Next, hospitals oppose efforts to reform hospital payments. Hospitals stand dead set against any site-neutral payments, which is something I talk about as a much-needed reform in the system, whether for rates on the hospital campus or off campus. Next, hospitals argue that any rate increase in Medicare and Medicaid is simply inadequate. They cannot possibly survive based on initial rates set by the government, as an example, whether state or federal. Next, while many hospitals get huge advantages through the 340B drug discount program, studies tend to show these lower costs don't go to help the lower income as designed by 340B, but again, to pad the pockets of the hospitals. And last, while hospitals blame plans for network contracting strategies, hospitals increasingly are adopting out-of-network strategies to drive greater payments. They also are exiting contracts with insurers to stop the growth of MA in America, which wants to hold hospitals accountable. So here's why hospital reform is really needed. Hospitals are not hurting overall. A JAMA study found that before the pandemic, hospitals were operating at 2.8% margins. But during 2020 and 2021, that more than doubled to an all-time high of 6.5%. And recent evidence shows that hospitals are doing well. Their margins are holding firm, even as utilizations has come back. Hospitals account for over 30% of all healthcare spending and tend to be the biggest inflation area along with drugs. This creates unsustainable growth into the future. Third Way points to a few studies covering this unsustainability. Other studies note that hospital prices have increased by 600% from 1990 to 2023. With COVID moving from pandemic to endemic, hospitals' inflation and spending are now again the most robust out there. So in conclusion, Third Way has it right. The Tale of Two Hospitals shows why hospitals need to become efficient, and in doing so, they would deliver better care. Bloat is both unprofitable and means poor quality. Hospitals, though, don't seem to care about their bloat. It has served them well over the years and guided their political engagement. But patients, employer groups, and the system as a whole will continue to suffer until regulators in Capitol Hill get the courage to reform hospital payments and demand accountability. It absolutely is key to lowering future costs in both the government and private healthcare sectors. With that, we'll end this edition of the Healthcare Labyrinth Podcast, and we'll see you next time. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.